The next organ system we're going to discuss are the bones and the joints, the skeletal system. The skeletal system is composed of the bones, the joints, the cartilage, and the ligaments. There are 206 bones on average that can be divided into two separate groups. The axial skeleton are the bones of the trunk and the head, or the skull. The appendicular skeleton are the bones of the arms and the legs, and the bones that help attach them to the axial skeleton. These are known as the pelvic and pectoral girdles. The skeletal system has several functions. Its first function is for support. It helps hold the body upright. Many of the bones cover vital organs and protect them. Without the skeleton, the muscles would have nothing to pull around, and so movement would not be possible. Fats and minerals are stored in the bone, so the skeletal system has a storage function, and also blood cells are formed in the bone marrow. Blood cell formation is known as hematopoiesis. Bones can be classified in two different ways. One is by the type of bone it is, the type of osseous tissue. Compact bone is very dense and smooth and homogeneous looking. Spongy bone has a lot of open spaces with small pieces of bone in it. It literally looks like a sponge. We can also classify bones based on their shape: long, short, flat, or irregular. Here you see the two types of bone tissue: the compact bone, very smooth, very homogeneous, and the spongy bone, which really does look like a sponge. Long bones are longer than they are wide. They have a shaft with heads at each end. The shaft has compact bones. The heads at each end have spongy bone. We find the long bones in the arms and the legs, the fingers and the toes. Short bones are kind of cube-shaped. These are a spongy bone center with a thin shell of compact bone on the outside. Some of the short bones are sesamoid bones. They are bones that form within tendons, and they form based on the stress that's put on certain joints. One sesamoid bone that everyone has is the patella. Other sesamoid bones will vary from individual to individual. The bones of the wrist and the ankle and the patella are all examples of short bones. Flat bones are thin, flattened, and slightly curved. Here we have two thin, compact bone layers with a spongy layer in between. The ribs, the bones of the skull, and the sternum are examples of flat bones. And finally, we have the irregular bones. They don't have any particular shape. They have a rather unique shape. The vertebra and the hip bones fit into this category. Bones are the organs of the skeletal system. They're composed of connective and nervous tissue. The long bone has a shaft in the center. This is made of compact bone. And then on the ends we have what are called the epiphyses. Epiphysis is singular, epiphyses is plural. These ends are made of spongy bone that have a compact bone surrounding them. There are membranes associated with the bone. These are dense fibrous connective tissue. The outer membrane, the one that goes all the way around the outside of the bone, is the periosteum, and lining all of the cavities on the inside of the bone is the endosteum. Long bones start out in the fetus as hyaline cartilage, and so there's a little bit of cartilage that's left in the bone. This is called the epiphyseal plate. This allows for the bone to grow in length. Whenever bones are growing, this epiphyseal cartilage is still in place. But at puberty, when there is the growth spurt, this area lengthens and then quickly ossifies. Once the epiphyseal plate is fully ossified, there will be no further growth. In the shaft of the bone, we have the hollow space known as the medullary cavity. In young children, this is filled with red bone marrow because it's involved in making blood cells. But as we age, we don't need to make as many blood cells, and so in adults, this is filled with fat, what we call the yellow marrow. Blood cell formation occurs in the red marrow, and there are a few bones where red marrow is still found in the epiphyses of the bone. Bone markings are simply ridges, holes, bumps, and grooves on bone. It's where muscles and tendons and ligaments attach. It gives them some place to attach, and some of the holes and grooves are where blood vessels and nerves pass through the bone. As we look at the microscopic structure, the cells of the bone are known as the osteocytes. You'll remember that in connective tissue, and bone is a connective tissue, the cells are separated from each other by the matrix. The lacuna are the little cavities in the matrix of the bone that the osteocytes reside in. There are two other cell types: osteoblasts, which secrete matrix and helps deposit calcium in the bone, and osteoclasts, which eat away the matrix. All three bone types are active in healthy bone. The matrix is hard because it has calcium salts deposited in it, but it also has collagen fibers to give the bone strength and flexibility. In the compact bone, we have what is called the Haversian system, or the osteon. Here we have little concentric circles laid down around a central canal. Now the central canal houses the blood vessel. Then there are these little tiny canals that go from the central canal to the bone cells, the osteocytes, which are here in the lacuna. This central canal has the blood vessels and nerves, and the canaliculi, these little canals going to the cells, help connect the osteocytes to nutrients. So this is how these cells get their nutrition, through these little tiny canaliculi. In spongy bone, we still have osteocytes embedded in lacuna in the bone part here. These little pieces of bone are known as the trabeculae, and in the spaces here is where we have the red marrow. Most of the fetal skeleton starts out as hyaline cartilage. This has to become ossified as the bone hardens. Hyaline cartilage becomes bone. First, the osteoblasts cover over the hyaline cartilage, and then the hyaline cartilage is digested, leaving that open medullary cavity. This all occurs during fetal development. A little bit of the cartilage is retained on the ends of the bones. This is known as the articular cartilage. This reduces friction when two bones rub together and does not ossify normally. There is the epiphyseal plate between the epiphyses and the diaphysis. This allows for bone length to increase, and this cartilage ossifies when growth is complete. So we start out in the fetus with this chunk of cartilage, sort of bone-shaped. We have osteoblasts that start to work on the inside, tearing down this cartilage. The osteoblasts continue to lay bone framework in here. Toward the end, just as birth is about to occur, we start on the epiphyses. And at birth, we have the epiphyses, we have the diaphysis, and we have this growth plate here, the epiphyseal plate. As long as this is open, the bone can get longer. Once this is also ossified, the bone has reached its full length. The bones of the skull are actually laid down by membranes, and the infant skull is different from the adult skull. If you think about an infant's face, it's very small compared to the rest of its head. That's one of the things that make people look youthful. The skull is about 1/4 of the total body length of an infant. Now, because these membranes ossify in a similar way to the cartilage, they don't fully ossify at birth. We have these little membrane spaces that are called fontanelles. These are regions that have not yet ossified. This allows for the skull to compress just a little bit while it's going through the birth canal. And it also allows for the last bit of brain growth. The brain is full-sized by the age of 2, so at age 2, all of these fontanelles can ossify. In the adult, the skull is only about 1/8 of the body length. The bones are fused at all of these suture lines so that we have a very solid, almost like one bone made up of several different smaller bones. Bone remodeling is constantly going on. We have to take calcium out of the bone from time to time. The need for calcium tells us when bone remodeling will occur. And then we have gravitational pull. That tells us where we will remodel a bone. Men usually have heavier bone markings than women because they have heavier muscle tissue. As they use their muscles, they put more stress on those attachment points. That will cause them to get thicker. When calcium blood levels are low, parathyroid hormone will stimulate the osteoclasts to break down bone to release calcium. This calcium will go into the blood. If we have high blood calcium levels, calcitonin will stimulate calcium deposit in the hard matrix of the bone as calcium salts. This will be a function of the osteoblasts. Rickets is a disease seen in some children. The bones fail to calcify like they're supposed to. Vitamin D is required to deposit calcium in bones. If these children have an inadequate supply of vitamin D, then their bones won't harden. They'll be soft and they will bend. Many times children with rickets have bowed legs. This is easy to treat. Simply give vitamin D to children while they're developing their bones. Osteoporosis is a bone thinning disease seen in older individuals. Osteoblasts and osteoclasts are constantly working throughout your life. Normally they work at about the same levels, but in osteoporosis, the osteoclasts get ahead of the osteoblasts, so more bone is broken down and less bone is made. Osteoporosis affects half the women over 65 and 20% of men over 70. There are some known risk factors for osteoporosis. Low estrogen is one of them. This is why women over 65 are at more risk. A low calcium diet, sometime during your childhood, you may not have had enough calcium to deposit in your bones. Also, since you need vitamin D to deposit calcium in bones, if the diet is deficient in vitamin D, this can cause a risk for osteoporosis. Women who are small in stature are more likely to get osteoporosis than taller women. Smoking doesn't help the situation, and there does seem to be a genetic predisposition. While bones are very hard and somewhat flexible, they do occasionally break, and we classify fractures based on the number of bone fragments we have. In a comminuted fracture, we have bone fragments. This is sort of a crushing kind of injury, maybe where somebody ran over a bone. In a compression fracture, we have crushed bones. The fragments are even smaller than in comminuted. Compression fractures are fairly common in people with osteoporosis. Simply the weight of the body will cause the vertebra to crush. A depressed fracture is when the bone has been pressed inward. A blow to the head may depress the skull bones into the brain. In an impacted fracture, the ends of the bones are forced into each other. This is the kind of injury we might see if someone jumped off of a building and landed on their feet. They would crush those bones into each other. In a spiral fracture, we have a twisting kind of break. Skiers sometimes get this because when they go down, one ski goes one way and one ski goes the other way, and it twists the leg. However, spiral fractures in children are a red flag for child abuse. You get them by twisting their arm back behind them. Children frequently get green stick fractures. Because their bones are not fully ossified and they have a little more protein in them, when they break, they tend to snap back and not look broken, much like if you try to break a green stick. It doesn't break cleanly. And finally, we have compound fractures. Any of these fractures could be compound fractures because a compound fracture simply means that the ends of the broken bone are sticking through the skin. Whenever there is a break, you have to reduce the fracture. This reduction is simply realigning the bone ends. A closed reduction occurs if the ends can be put back into position without breaking the skin. An open reduction is when surgery is done to help secure the ends together. Usually pins and metal plates are involved in getting this bone back together. There are 4 steps to bone repair. Fractures repair by first developing a hematoma. That is, when you break the bone, you broke all of those blood vessels that were in that compact bone. So we have literally a clot forming in the area to hold the 2 ends of the bone together. Then we develop a fibrocartilage callus. Connective tissue begins to replace the clot, and this sort of acts as a splint that helps pull the bone fragments more permanently together. The fibrocartilage begins being converted to bone at that point. Osteoblasts and osteoclasts move in and begin to remodel the bone. They begin to replace the fibrocartilage with bone, and then they do the final remodeling. Remodeling occurs in response to the mechanical stress placed on the bone. The fracture site will be as strong as it was before. This is a very permanent patch. So as we look at bone repair, first we have those broken blood vessels and we get the blood clot, the hematoma. Then we begin to get fibers, connective tissue fibers forming to help more permanently strengthen the bone, pull the bone together. Then we begin bone formation, and at the end we get fully functional bone. The other part of the skeletal system are the joints or the articulations. Every bone forms a joint with another bone except for the hyoid bone. This is a little horseshoe-shaped bone in your throat that is suspended in muscle. Joints help hold the bones together and give us the mobility that we need if we're going to move around. Joints can be classified based on how they function, their movement, as well as their structure. Functional classification are as synarthroses. These are joints that don't move. Amphiarthroses, joints that have slight movement, and diarthroses, joints that are freely movable. Now all of these words are plural. To make them singular, you change this E to an I. Structurally, how the joint is made up is another way to classify the bone. We have fibrous joints, cartilaginous joints, and synovial joints. Fibrous joints are held together by fibrous tissue. Some of these joints are immovable. The fibers are very short. An example of this would be the sutures of the skull, those joints between the bones of the skull. Fibrous joints may give very slight movement. Now these are sometimes called syndesmoses instead of amphiarthroses because they tend to ossify with age. Here the fibers are a little longer and there's a little more give. There's a joint like this at the end of your tibia and fibula in your lower leg. It helps hold these two bones together, and yet your ankle still has some mobility. Cartilaginous joints are connected by cartilage. Some cartilaginous joints have slight movement. They are amphiarthroses. We see the cartilage between the pelvis and the cartilage between the vertebra give us a little bit of movement from time to time. Some cartilaginous joints are immovable. There is cartilage that holds the first rib to the sternum, and this joint does not move. Synovial joints have a joint cavity that's filled with synovial fluid. These joints are freely movable. These are all diarthroses. We see these in the arms and the legs, the wrists, the fingers. These are where synovial joints are found. So here you see a suture, a fibrous joint, an immovable joint. Here are some cartilaginous joints. This is a synarthroses, no movement here. These are amphiarthroses between the vertebra and between the pelvic bones. Little bit of movement here. Here is that syndesmosis between the fibula and the tibia, that fibrous connective tissue that allows for just a little bit of wiggle, but as I said, this usually ossifies as you get older. And then most of the joints you think of, most of the things you think of as joints, are these synovial joints, which are all diarthroses. Synovial joints are the ones that we talk about the most. They have a articular cartilage which covers the bone ends. This helps form the joint. Then there is a fibrous articular capsule. This helps hold the two bones together. The joint surface is covered by connective tissue and it's lined with the synovial membrane. This forms a joint cavity. This is what's enclosed in the capsule and contains that lubricating synovial fluid. Some joints, if there's enough stress placed on them, will also have reinforcing ligaments. Ligaments are dense fibrous connective tissue that help hold bones together. Here you see a synovial joint in the shoulder. Articular cartilage on the surfaces of the bone. We have the synovial membrane, and we're going to have the synovial fluid in here. Now, there's never very much synovial fluid in a joint. Your knee joint is your largest joint, and it only has 5 milliliters of synovial fluid in it. That's a teaspoon. Another feature you see here is a bursa. This is a synovial sac that has synovial fluid in it that's going to act as kind of a ball bearing. So bursa are those little flattened fibrous sacs with a synovial membrane and synovial fluid that act as ball bearings that help reduce friction when tendons and ligaments cross joint. Bursitis is an inflammation of a bursa or the synovial membrane of the bursa. Usually this is when a joint has been overworked. Rest typically takes care of bursitis. A sprain is when ligaments or tendons that hold the joint together or hold the muscles to the bone are overstretched or even torn away. Because these are both connective tissues that have almost no blood to them, they're very slow healing injuries. And a dislocation occurs when the ends of the bone are out of alignment with each other. The easiest joint to dislocate is the joint between your jaw and your skull. The second easiest joint to dislocate is your shoulder joint. Now there are several different types of synovial joints. Here we have what is called a plane joint. The articular surfaces are basically flat. There is little short movements, little short slipping, sliding movements that occur, and this is what we see in your wrist and your ankle. The hinge joint has a cylindrical piece of one bone that fits into a groove or a trough in another bone. This allows for us to move like a hinge. We can flex and extend. The elbow, the ankle, and the fingers have this kind of joint, as does the knee. In a pivot joint, we have a round end that fits into a ring. This is the radius and the ulna. This is the point on your elbow right here. This allows one bone to rotate around the long axis of another. If you put your arm out with your palm facing up and turn your palm over, that rotation occurred up in your elbow joint between the radius and the ulna. This is called the radio-ulnar neck. A condyloid joint has this oval, egg-shaped end that fits into a concave oval that matches it. This allows you to go side to side as well as back and forth, so you can abduct, adduct, flex, and extend. Your knuckles have this kind of joint. The saddle joint is very, very important. Here you have sort of like a rider in a saddle. You have convex and concave ends that fit together. The only location you have this joint is in your thumb. This gives you side to side and back and forth movement, but it allows for what is called your oppositional thumb. You can take your thumb and touch the tip of every finger. Now you might think this is not a big deal, but try taping your thumbs down and doing anything, like picking up a bottle of water, opening a door, anything. You actually need that gripping movement, and you can only do that because you have a saddle joint. And then finally we have the ball and socket joint. Here you have a rounded sphere that fits into a cup-shaped socket. This gives you the most motility of any of the joints. This is the most freely movable of the joints. This is the kind of joint you have in your shoulder and your hip. Arthritis is an inflammation or degenerative disease that damages the joint. Acute arthritis is usually bacterial in nature. There is a bacterial infection in the joint causing the synovial membrane to thicken. The production of the synovial fluid is reduced, and the fluid that is produced is very thick and sticky. This can be treated with antibiotics, and this kind of arthritis goes away. If you have strep throat that goes untreated, you may get bacterial arthritis. The same is true of gonorrhea. Gonorrhea can go to the joints, and you can have gonococcal arthritis. The most chronic forms of arthritis are what we typically think of as arthritis. We have osteoarthritis, rheumatoid arthritis, and gout. Osteoarthritis is sometimes called wear and tear arthritis. This occurs with age, and it's simply as a result of degeneration of the joint because you have walked on it and moved it for years and years and years. Basically, if you live long enough, you're going to have a little osteoarthritis. As the cartilage gets damaged, it will begin to ossify, and you may get bone spurs. Extra bone tissue may grow in the joint. You may get little cups of bone tissue, and that will restrict joint movement and be painful. Joints with osteoarthritis frequently have kind of a crunchy noise to them when you try to bend them. Rheumatoid arthritis is an inflammatory disorder. The synovial membrane thickens into a membrane that's known as a pannus. This will cling to the articular cartilage. Then the body's immune system begins to destroy tissue. Rheumatoid arthritis is considered an autoimmune disease. As such, it can occur at any age. Even very young children can have rheumatoid arthritis. As the cartilage is destroyed, it's replaced with scar tissue, and this scar tissue typically ossifies. This can be crippling, and the joints typically fuse together. This is the kind of arthritis where you have a mangled-looking hand or foot. Gout is more common in males above 30 years of age. This is a problem with uric acid. Uric acid is one of the byproducts of protein breakdown. Uric acid normally is cleared in the urine, but in some people it accumulates in the blood and it deposits as crystals in the cartilage and soft tissues of the joints. This makes it very painful when you go to move those joints. The great toe, or the big toe, is a common spot for this to first happen. If this goes untreated, the bones may fuse together and you will no longer have a joint. Gout seems to have a genetic predisposition, that is, it tends to run in families. Individuals who have gout are recommended to lose weight, to avoid alcohol, and certain foods like shellfish. Shellfish are very high in the protein that will yield a lot of uric acid.